Okay, so welcome. This is the third edition of the Keep Them Guessing podcast.
Congratulations on the podcast, by the way.
Thank
I know
you.
it's something we've talked about for a while, and you finally jumped fully in.
Yes,
and I was
fully.
sitting there listening to a couple of the earlier podcasts,
Yeah.
and I'm just in awe because you never do anything lightly. Everything is 100% professional.
Thank you.
And, the backstage here, the lighting, the audio, the videography, everything is Hollywood 100%.
Thank you. Appreciate it. So we have none other than Dr. Vranis here, who I have to tell you a little bit about, but I'm going to have him tell us about his background more than me and more in detail. And we're going to talk a lot about what goes into even becoming a plastic surgeon. So we're going to really get down into it because I think some people think we go to beauty school. So I'm going to talk to them about the pedigree. We're going to talk about the background, what it takes, the dedication, the hours. I'm also going to calculate, and I've already done this, based on hourly when I worked during my residency, what my hourly pay rate was, which is very interesting to look at.
I did the same calculation.
Yeah,
Does
yeah.
every
So let's see if
resident do it?
Yeah, let's see if it matches. So without further ado, Dr. Vranis, welcome. Dr. Vranis was my fellow over 2 years ago, which means that he could have just gone into practice and done what most people do, but he decided to do an extra year of dedicated aesthetic fellowship under our fellowship in Los Angeles here that I do with some of my colleagues, including Dr. Jay Calvert, Macias, Justin Perez, Andrew Orden. Who else is in it?
Nate Villanueva is involved.
Yeah. So we have phenomenal Ritu Chopra, really good surgeons who teach us rhinoplasty, very in-depth, deep plane, high smash facelifting, S-curve or buttock. So you get a lot of really good training in this fellowship. So he did that. Then afterwards, I've had people write me, email me, DM me, text me if I'm looking to have someone in my practice, if I need someone to join. And really, it took me a long time to find the right person and be open to it. I needed somebody who had the humility to take self-criticism for themselves, to take constructive criticism, not get all butthurt, and to also have the walk the talk philosophy that I believe in, which is if you're going to be confident and you're going to do what you're doing, you need to be really good at it. So you got to be good with your hands. You got to be able to be a good physician first, then surgeon second. You got to be able to analyze, diagnose problems. You got to also care for the patient, be there for them. You have to lose sleep at night if a patient's going through something, and both him and I share those qualities. So I welcomed him into our practice. Welcome officially to the podcast, and you're over 2 years now in the practice.
Yeah, year 3. It's time flies.
Yes.
And it's been really fun. It's been an enjoyment to join the practice, join the team. And, Dr. Ghavami obviously has been a staple here in Beverly Hills and has a global presence. And obviously the team here reflects that. And it's really nice to join into a well-oiled machine that you step in, and on day one, things are great. The patient coordinators are amazing. The front office does their job well. The office is beautiful. By the way, we just remodeled, and congratulations.
Yes, thank you.
It looks awesome. Patients are noticing too. They
Good,
walk
good.
in, especially the ones that came a year ago, and then they come back and they say, wait, something looks very different. I don't like it.
We did a facelift to the practice. Next will be mine. No.
But anyway, going back to your earlier thoughts here or comments, that it takes a lot to become a plastic surgeon, right? Like, yes, you have undergrad. Yes, then you go to med school. Once you're in med school, you have to be top of your class to end up in dermatology, neurosurgery, plastic surgery, orthopedics. I think those are
The most competitive. Yeah, the most competitive at the time when I was applying. So first of all, getting into med school is not easy. Actually, we should get down to the nitty-gritty. Even though it's cold in this room, let's get down to it.
Oh, yeah.
We're not taking our shirts off, but just let's get chill, comfortable. When we get into the nitty-gritty of things, kind of like
Be a fun
how
conversation.
Mr. Rogers did that. I'm not changing my shoes into slippers, and I don't have a cardigan, but here we go. Okay, so plastic surgery training, first of all, you have to be top of your class in medical school. Getting to medical school alone is not easy. You have to do well on your MCAT, which is a test. You have to be have good GPA. And once you get into medical school, you have to excel in medical school, probably do some research, get to know some surgeons, maybe travel to some conferences and go over and beyond to get into certain industries. At the time, I would say plastic surgery, dermatology, otolaryngology, which is ear, nose, throat, orthopedic to a degree, although there's a lot more residency in orthopedic than there's plastic surgery. So just by sheer number, I think the number of people applying from medical school to plastic surgery residency programs and the number of programs available at the time.
The number of spots. Because each program can either have 1, 2, 3, or 4 spots. That's it.
Yeah.
No program has more than 4.
It's the most competitive.
Yeah.
So you were where in medical school? Tell us a little bit.
I was at university. So I went to Johns Hopkins University for undergrad, stayed in Baltimore at University of Maryland for medical school, which was in-state. And then I went to NYU for residency. And just, I don't know, did you guys have away rotations?
No.
So for
we didn't
us,
need it.
So I think this is the hyper-competitive nature of it. As time goes on, people realized, oh, wait a second, if I go spend a month at another hospital, I get a whole month to show them what I can do, what I'm capable of, and things like that. So if you're applying to these competitive, ultra-competitive specialties, you're doing a 1-month rotation. But that is basically a 1-month interview. And I remember I was working probably like 16 hours a day for 30 days straight. But then you're doing it for 3 months in a row because you're doing it. I did it at Northwestern, 1 at Hopkins, and then 1 at NYU. So that's like 3 months in a row where you are working nonstop, which is just an interview.
So let's figure this out. We got to do this real quick. Okay. So I figured out how much I made per hour during the hours I spent. Now, I was a resident at the time, and I'll go through my training a little bit, but this is more about Neil today. At the time when I was a resident, integrated plastic surgery residency, especially actually during the plastic surgery years too, because I did not go to easy programs. But before that, in the general surgery preliminary years, I made $1.25 an hour. What did you calculate?
Mine was $3.50.
You did better than I did.
I know.
So
inflation. There's inflation though.
Well, but did the 80-hour work week apply to you?
There's loopholes because when you're on home call, we never. Yes.
So explain home call. They don't know what home call is.
So home call is this thing where you go home supposedly, but we are all living within a 3-block radius in New York from the hospital, and whenever there's a triage system like a hierarchy, so the intern in the second year have to stay in the hospital for 24 hours and then 12 hours, and then they go back to 24 hours and 12 hours. So they alternate those shifts. And then basically if they have something that they can't handle, something that's going to the operating room, they have to then call the 4th year and the 6th year resident that's on their team. And those 4th and 6th year residents are the people that are on home call. But every day there's something going on in the emergency room that, you know, we did a lot of hand surgery also, face fractures, but, you know, distal radius fracture, open, you know, severed finger that had to be reconnected, revascularized or, you know, replanted. And so the intern almost every night is calling the 4th year for something. Maybe every second night, the 4th year is calling the 6th year to come in to go do a surgery.
Yeah.
So you're doing a full day of work. You go home for an hour or two, but you're always on the high alert. Because if that phone rings and you're in the shower, you're jumping out of the shower, answering the phone call, and running in. Yeah. So you're sleeping. It's 2 a.m. You just fell asleep. You got into REM sleep.
You can't turn off your phone.
That you're getting called back in.
Back then it was pagers, but I had a pager.
I had no straight to phones. Actually, I did have a pager, but I never turned it on. They gave us a pager,
but you didn't need it. I've had nightmares. I have actual nightmares where my pager's going off, and I'm like I didn't get it to the hospital in time, or I didn't make it there. Like, you dream this stuff because you lived it. So that's really a testament to our training, because we spend hours and hours and hours, and every single minute you stay in the hospital, every minute that you're going to the ER and evaluating, even if it's just a pus-filled sore on the shoulder, or whether it's someone who broke their leg and has their like bone sticking out and you have to reconstruct that. Or one of mine, I'll never forget, is a motorcycle accident where the guy slid on the asphalt and all his face was off. It was like that one scene from Breaking Bad. You guys remember this scene right here? Where in Breaking Bad, the guy was rotating his head and he literally had an eyeball with no tissue and just bone. I mean, I saw that and had to reconstruct it. By the way, I was on call. Obviously, I'm not going to go home. I stayed for the reconstruction, because the more you stay there, the more you work, the more you improve, the better you get at both diagnosis, evaluation, and executing, especially with surgery or treatment. So, okay, so you were
rewarded for staying. So I'll never forget, second year, I'm starting year 2. So it's basically July of my second year. A Saturday, I finish rounds, and there's a replant going on overnight into like the morning hours.
What's a replant?
It means basically when someone takes their finger's cut off, and then you're reattaching it. And the way it works
Here it is, like this. Look.
Oh, just there you go. And then here's the replant. You put it back on. And so to do it, though, there's a blood vessel on each side, a nerve on each side, and then the bone in the middle that keeps everything, the integrity in place. But basically, I do the round Saturday morning, and they put the one blood vessel up, and the fingers can live on one blood supply. So as soon as you get that, then all of a sudden you can breathe and say the finger's viable and can survive. So then they say, you know what? You hustled, overnight, this, that. You stayed for rounds. Why don't you come and do the second vessel?
Yeah.
And so I'm under the microscope as a second-year resident, putting the, the second, it's a bonus vessel together. But you're doing this. It's a 1 millimeter vessel. And so that's
Did you
when
like
I realized
micro?
I loved micro.
Micro is great. I actually did a hand microsurgery fellowship, although I don't do microsurgery anymore. But knowing how to sew under the microscope with 8.0 to 10.0
12.0
suture, these sutures that you can't really see with the naked eye, especially my eyes now. What you have to do is basically be under the microscope sewing these little vessels. Sometimes, the worst and toughest case I had was a revasc, not a replant.
Mm-hmm.
Revascs are harder because it's a revascularization. The finger is still attached in some way, but not meaningfully. And you have to go in and deal with something there instead of the ability to be able to put a finger back, shorten it, and do things because it's already attached. On a kid who was 8 years old who fell into a lawnmower with the hand. So we're going to get into some aesthetics, so let's jump to it. But first, so you were at Hopkins, and then what's the rest of your training? Because we want people to know we didn't go to beauty school. This isn't some one-year little thing we did. Like, we were hustling. We were passionate to get there. And at that time, there was no social media. There was no YouTube. There was none of that, at least in my day. Right now, you have pre-med students with their own Instagram page, med students with their own Instagram page. We'll talk about the future things at the very end, but you went from Hopkins. What was the next thing?
4 years of Hopkins undergrad, 4 years of medical school, then 6 years of residency of integrated general surgery plus plastic surgery, and then 1 year of fellowship, which I came out here to do with you, Dr. Chopra, and the rest of the team. And then that's the end of training. But that's 4 plus 4 is 8 plus 6 is 14 plus 1 is 15 years.
I've done that calculation a lot. I don't even want to think about it.
Yes. So then you start. But it's like being a pilot. You don't just go from 0 to 1. I think that's what patients also don't understand is that you've been operating now for the past 9-10 years because you're starting.
I calculated it out. So if you break down, let's say, a rhinoplasty that I do, I never go in and do a nose job where I'm just doing a rhinoplasty. I'm always doing a septoplasty because I'm borrowing cartilage, trying to correct any crooked septums, which is the wall between right and left side. And I'm doing a turbinoplasty or something with the turbinates to move them out. So within that rhinoplasty, that's technically 3 procedures. I'm not getting to get into right and left because sometimes for insurance coding, you divide right and left or both, and then it can be double, but we're not going to cheat. So a rhinoplasty, when I go in, the basics is 3 surgeries, really, in one. Or if I do a rhinoplasty with fat grafting to the malar, under eyes, nanofat, and a laser treatment, or maybe a platysmoplasty, that's 7 surgeries in one person. So number of surgeries, I've calculated average, approximately how many I've done since I've been in my career in Beverly Hills, over 30,000. Over 30,000. So the number of, it's like a race car driver with seat time. They could say seat time. How much you've sat in the seat driving your race car determines how good you're going to be at racing, and it can be down to the 0.0001 milliseconds. So then the hours you spent, the call, you've dedicated yourself, you came out here in Los Angeles, Beverly Hills. So tell us about what you think about aesthetic plasticity right now, because we see things trending. There are plastic surgeons that are board certified, which let's talk about boards, and tell us what you think. Why are some plastic surgeons just not good? Some really aren't good. I have people who've had the training we've had, but I'll bet you they cheated and didn't take call as much or wasn't paying attention. They weren't reading. They weren't into it. They did it maybe just for the money.
I think
why are some not good?
I think you have some bare minimum bottom feeders, right, that get into the good programs just to say they got into the good program, and then they do the bare minimum to get by. They do the bare minimum cases. As soon as their call's done, they just go home and shut down. They don't stay extra to do that extra case, to go do that extra chair time that you're talking about. I think there's also innate talent. There's just some people that just don't see the 3-dimensional space. And surgery is a very 3-dimensional, artistic, but also mixed with architecture, engineering.
Your hands,
the hand-eye coordination. So athletes, you play guitar, I play sports. but there's something to it where we just have I think, a hand-eye coordination that's different than the average human. And so I think there's that aspect of it. And then I think there's also people who didn't go to these like premier residencies that are plastic
Didn't get
surgeons,
good training.
but they just didn't. Exactly. They went and saw 4 breast reductions every week. They met their bare minimums that the ACGME put out, and they graduated, and they're plastic surgeons, and that's great. But you know, they haven't seen the complex revisions and the anatomy, because everything goes back to anatomy, whether it's reconstructive or cosmetic. You have to know the anatomy inside and out. You have to know exactly where the nerve is going to be, where you're anticipating it, where the blood vessels are, where the muscles are, and then you can it's almost like a city map for a street.
But you got to know what to do with it.
And then, well, first you got to know where it is, and then you have to know what to do with it. And I think that's the problem, is people are trying to do stuff with things that they don't even know where it is.
And that's
like
where you get in trouble.
If you don't know which plane you're in the face, and you get in big trouble. And I know there's definitely a couple of people that we've heard some stories here recently, or in, neighbors that get in trouble because they don't know which layer.
They don't know where they are.
They think they're superficial, but they're deep. They think they're deep, but then they're superficial. They buttonhole.
So you could be a board certified plastic surgeon, which means you're actually certified. You're legit. You have a certification by the American Board of Plastic Surgery. So there are certain standards. There's a written exam, an oral exam, which is sometimes has a 25-30% fail rate, just the oral exam. I think it had a 18% fail rate the year I took it. And the thing is, doesn't mean that you necessarily know how to do and execute the right nice curve in a buttock, to do a clean breast augmentation that looks natural. That comes with taste, judgment, your hands, and honestly, your training. Like, we were fortunate. We trained under people, and then you came into your fellowship where, like, let's say you're learning to play basketball. Like, there's a difference. You'll get good if you learn from your, like, dad who played at the park, or you played the park sometimes, and you're going to be good. But if you go to basketball camp every year and from the age of 8 play basketball under, like, the legendary Kobe Bryant or Magic Johnson or Iverson or, like, some of these, like, greats in basketball, or if you're learning how to paint and you're in a school of art and you happen to learn under Picasso, Salvador Dali, Renoir, and, like, Monet, you probably are going to end up being pretty good, unless you really just are there for the wrong reasons, not paying attention, and just don't know how to hold a paintbrush. It's the same thing with plastic surgery. We trained under some giants. We had our pedigree is good. So we were lucky and fortunate that way. We sought it out. We were passionate. Some people, they go to programs. I know of people that have done full plastic surgery training, have only done one nose job before graduating, and they don't do a fellowship, but they go on Instagram and talk about rhinoplasty as if they're an expert and just show other stuff and the 5 things not to do when you do a rhinoplasty, but they've only done 2 rhinoplasties, but not, 5,000. So how do people even decide, like, if someone's American board certified plastic surgeon, they're legit. They're not, like, faking it. It's not an OB-GYN that went and did a few courses and certified in cosmetic surgery and calls themselves a cosmetic surgeon. It's a legit plastic surgeon who did board training. How would someone tell within that group that's already elite how if someone's going to be good?
I think it's almost impossible. Dr. Fritz Barton said it the best. I think your work speaks for itself. When they meet one of your patients or their friend was operated by you and they got a great result, scars are well hidden, they're nice, it's artistic, it's not overfilled, it's not underfilled, the facelift is tight but not too tight, not windswept, but it's also not loose. That person knows exactly what you're capable of. The problem or the question becomes is, how does someone who's seen your work on Instagram, a website, or just heard about you on a podcast, how do they know you're legit? And that's a little bit of a leap of faith. I think it's a little bit of, they have to come in, meet you, see what your confidence is, your confidence level, maybe, see some before and afters, go through with the patient. These are the before and afters. This is what the patient wanted. This is what we delivered. These were the shortcomings, and just be honest with them. And I think if they realize it's like a dating. Yeah. When your patient comes to your office, it's basically an interview or a first date where you're saying, like, you're interviewing them and they're interviewing us. Yeah. And so I think it's a match, and then it's great. And
match is important.
And what you also talked about earlier was just being a good doctor. Is at the end of the day, yes, they also want the patient also wants to be reassured and confident that you're going to stick by their side. If there is going to be a small little touch up, you're going to be there to do it for them. And you're not going to say, oh, no, that looks great, go out, get out of here. Yeah. You're going to be there if there is a, medical, something. That's why we have amazing anesthesiologists. We have a facility that was accredited by the Quad A, certified. Yeah. We're doing everything we possibly can. But if for some reason there's a hurricane or the ceiling falls down and something unpredictable happens, they know that you're competent and you're care enough to make sure that they make it through safely.
I think that's important. It's hard to interview that. I mean, unless you know people. I still think, despite Instagram and everything, word of mouth is the best. I mean, I would say the majority of my practice is not Instagram, even though I was one of the first to be on Instagram. The majority of my practice is from patients who have a brother, a sister, a girlfriend, or a new wife, or like an old wife, or whatever. Like just people that are in the circle, in the kind of, I say, the Ghavami family, who either know someone or are someone who's had surgery by me over the past now almost 20 years. Okay, so when it comes to representing your work, you have an Instagram, I have an Instagram. We've been on some podcasts. This is one of my first 5 podcasts here. I don't know what number this is going to be, but it's one of the first early podcasts. So this will all keep evolving. I really wanted to make sure we reintroduce Dr. Vranis to the practice. You could have years ago, you could have just gone into practice, hung up a shingle, paid someone, created a really cool Instagram page, and not done any further training, and you still would have been great. He's phenomenal with his hands, his acumen, he cares, he loses sleep. We talk about it, I lose sleep if someone's not doing well. And the human body is not going to always heal perfectly. It's unpredictable by nature, but you want someone who's there for you, who's going to try to make it right, and who's going to do the best they can. And if you end up walking and you decide, I just want to go a different direction, then so be it. But what do you think is the best way that you represent your work? Do you like Instagram? Do you like social media? And tell us about your Instagram page too.
I do have an Instagram page, and I'm trying to
curate
it.
Right here.
I'm trying to curate it as much as possible with some of the highlights. One of my downfalls is I'm a perfectionist, and unless things are perfect and that the patients have given permission, obviously you can't post to everybody, which is unfortunate. But I critique myself, I hyper critique myself, and the only ones that really make it through are the ones I'm very, very proud of. And and I see other pages that just put volume up there, and that's not the type of person I want to be. I want to be the ones where I'm like, and the work speaks for itself, where it's just like, okay, this is a difficult case, or it's a case that I'm very, very happy with the result and proud of it, and I want to show it to the world. And I'm obviously I'm very grateful for the patients that allow us to do this, because very few do, but the ones that do, thank you very much for that opportunity.
It's a privilege.
And it's a privilege
to be chosen to work on someone's sacred body and face. It's sacred.
They go to sleep and they put full trust in your hands. I mean, can you imagine that? They voluntarily go to sleep and say, hey, we talked about this, please do it, execute.
Exactly.
And we take that very seriously. But the same way that you got approached many times with people wanting to join your practice, and you were very selective, I was very lucky also, where I had a lot of people that wanted me to join their practices also. And
I had to fight for him a little bit.
Oh, just a little bit. I made him keep him guessing. I had to keep him guessing for a couple of months. But no, the reality is that I did feel when I first came here and we met and we worked together as your fellow, under those circumstances, I just felt at home, and there was this connection that I think we had, and a mutual level of respect that I appreciated. And I just saw a great future together, both, professionally, but then also personally. And, we have a great time outside of the office.
Tennis.
Also, a lot of tennis, a lot of, other
shooting range,
other good things, some crazy driving experiences. But there's more to come. And I think that's one of these balances that I just really enjoyed joining the practice. And I'm very, very happy to be here.
We're lucky to have you. So interesting. Let's get into background a little bit, and then we'll end. Neil is Greek, and we joke because of my Persian background. We've never had a 300 moment yet where there's been a war or a fight. We've just had discussions because we're men, and we just kind of like talk, discuss, and then it's done, and then we go have a beer or whatever. In my case right now, a gluten-free beer. And so he takes care of his health. I do everything I can for my health. I actually bought him a Whoop for a gift. He's wearing it now. I wear my Oura Ring just to sleep. I don't want to know my stats during the day, but I will wear it during tennis once. I want to see how we compare. But so he's he has a lot of humility and everything, and I kind of like the fact that he's kind of from an ancient background. Which, by the way, I always send him stuff on Instagram about how essentially everyone's Persian, the Greeks. And we look alike. He's like, a younger, better-looking version of me.
How many patients have asked you if I was your son?
No, not son.
None?
God, I hope not. No, younger bro. But it's mostly just, he's the younger, better looking version of me. I used to have a full head of hair like him, and I never had his chin and jawline. But so essentially, you have to take care of you first. It's kind of like the airplane where they say you put your oxygen on and then worry about your child or your loved one. So you used to play almost professional soccer. What's your main regimen for health? And then we'll go over mine. We'll see.
Yeah, so I think there's a good element of genetics. I've always been lucky. I've played 2 years professional soccer and then always maintained a good athletic balance. So I go to the gym at least, hour and a half a day. I eat fairly well, but that being said, I'm not strict and stringent. I will enjoy a dessert. I will enjoy pasta. I kind of believe in a balance. Yeah. But if I have it one day, then the next day, obviously, I'm going to be lean a little bit more healthier salads or beets or whatnot. But
do you care if like your red meat's grass fed and like what's?
I'm starting to. I never had that luxury beforehand, and
did
now
I force
slowly.
that on you?
No, it's not. It's not that you're forcing. It's just I think there's certain luxuries in life. When you're in training and as a student, you don't have the luxury to be picky. Food is food at that point. If I just saw pizza in the call room that was from yesterday, I probably would still eat it.
Yeah.
Now I think you have the luxury to think about, what's grass fed, what's better for me, things like that. And it makes a difference. I feel better now than I did 5 years ago, which is
it's crazy.
The sleep has been great. The food's better, and it shows. I feel healthy. I'm more vibrant. I think I look in the mirror and I look better to myself. And at the end of the day, that's what matters. And you're right, because you want to be well rested for every single case that you get into.
Yeah. I'll tell you, speaking of cases, in Dallas once I did have, I don't know if it was that one child's replant from the lawnmower, but I was called in. Oh, I think it was a spaghetti wrist, which means we call it spaghetti. It's weird. And like my junior resident at the time was trying to be funny. He's like, hey, are you in the mood for Italian? I'm like, oh. Spaghetti wrist is when the wrist is cut off, usually by what I call unskilled saw surgeries. There's something called a skilled saw for carpentry, and it can jump. So that happens a lot. Happened in Texas. Drunk people working in their garage 2 a.m. with a cigarette dangling. And so the wrist looks like spaghetti because all the tendons, nerves, and arteries, veins are just sticking out, and it looks like spaghetti. So it was one of those. I had a Big Mac, a cheeseburger, a large fries, a large extra large Coke. Then I chased it down with the McDonald's McCafe coffee and had that in one fist, and then on the way to the OR with a hot fudge sundae.
Which is probably 2 in the morning, by the way, right?
Yes,
so you've also lost sleep.
Yeah.
It's not like you just did this and it's 8 a.m. and it's a real work day. This is
it was. Well, I was called in late. I don't know. Whatever it was, McDonald's was open late there at Parkland, which was the county hospital. So now what I do, and I'm very similar to you, and I have to be a little bit more mindful because I'm like a year or two older than you.
Just 2.
Yeah. So what I basically do is, I try and make sure my meat is lean, organic, obviously, but, grass-fed lean red meat is actually phenomenal for you. I feel like we're somewhat carnivores, and that's my philosophy. Although I am dairy light, essentially dairy-free, especially cheese. I love and miss cheese. I'm trying to avoid processed meats like my favorite mortadella, chorizo, salami. Now I'm getting hungry. Pancakes have to be buckwheat or gluten-free. And then I'm trying to be gluten-free for the most part, gluten light. One thing they have gluten-free down really good is pasta, and they have breads are pretty good. They have good multi-grain gluten-free breads, but they have pizza crust down, pizza dough, either cauliflower or gluten-free. And that's really helped me. I have all this energy, even if I get 7 hours, which I prefer 8. If I get 7 hours of sleep, I go into fairly good amount of REM sleep, deep wave sleep, and I just feel like I'm 25 in the morning. Us Persians have to knock on wood. Yep. Where is it? This thing's not wood.
No.
There's no wood in here. There we go.
Right
this is wood. Okay. Yeah. So basically, you have to take care of yourself first. Neil and I play tennis. Sometimes I win, even though he played soccer and is an athlete.
His serve has gotten very, very good. You've actually taken a lot more lessons than I have. So.
I had to. But you played before I did. I started playing 2 years ago. So aside from all this, very important, his pedigree is great. It worked out. Some things are just meant to be. I feel like he's the younger brother I never had. We're in practice together. He could have gone and just hung a shingle 3-4 years ago and didn't, did training. Stayed on with me, phenomenal surgeon. And so welcome officially again, Neil, and welcome to the Keep Them Guessing podcast.
Thank you.